COVID in America. On the 9th of January, 2020, the World Health Organization announced a mysterious coronavirus in China. On the 21st of January, the first confirmed U.S. case of infection was announced in the state of Washington. On the 15th of February, there were 15 cases of infection and no deaths in the U.S. On the same day, China reported 68,500 cases and over 1,600 deaths. On the 11th of March, the World Health Organization declared a worldwide pandemic, and a few days later, schools and businesses began to close. In the U.S., we had reached 2,700 cases and 44 deaths. March the 11th, 2020, day one of the pandemic. The purpose of this video is to provide a very brief overview of the pandemic in the U.S. The pandemic rolled back and forth over the country in multiple waves. After 2 years, we are now at the end of Wave 6, with no clear end in sight. The 1st of May, 2022 marks day 782 of the pandemic. Let's start at the beginning with Wave 1. I have used 3 charts to discuss each wave. The first chart covers the size, shape, and intensity of the wave. It is a chart of the daily progress of the pandemic. From top to bottom, it shows new cases of infection, total hospitalizations, and the new deaths for each day of the wave. For example, new cases reached a high of 31,000 cases per day on April 12th, the worst day of the wave for new infections. Total hospitalizations due to COVID peaked at 58,000 on April 21st. New deaths peaked at 2,300 per day on April 21st. The virus struck first in the Northwest, in Washington state in February, then took hold in the densely populated centers of the Northeast. It attacked the most vulnerable, sweeping through the elderly population and nursing homes in particular. Wave 1 lasted 100 days or so. Infections had reached over 2 million and deaths 132,000. The highest estimated yearly death toll from influenza over the last 10 years was 61,000 for the 2017-2018 season. We were twice that by day 100. COVID was definitely not the flu. This is a chart of the U.S. population by state, with California on the far left and Wyoming on the far right. I show this because I have used this same format to present the state pandemic information. This chart shows the total cases and deaths for each state during Wave 1, with California on the far left and Wyoming on the far right. The case chart shows that the hardest hit states in terms of total numbers were California, New York, Illinois, New Jersey, and Massachusetts, shown in green. The death chart shows the same picture with New York, New Jersey, and Massachusetts having the highest numbers. But these charts don't tell us the whole story. They show a big spike for the big states, which we might expect, but don't tell us much about the smaller states. A small state may suffer just as much as a big state, but not stand out like a big state in terms of overall numbers. To address this big state, small state issue, I took a crack at creating an index of stress for each state based on that state's per capita infections and deaths. The index is independent of population. The stress index shows how the state differs from what would be expected by population alone. By this measure, the U.S. average stress level for Wave 1, shown in red at the far right, is 7.8. The index shows that along with New York, New Jersey, and Massachusetts, the smaller states in the Northeast, Maryland, Connecticut, Rhode Island, Delaware, and D.C., shown in green, also showed high stress levels. In addition, 2 states outside the Northeast, Illinois and Louisiana, shown in orange, also ranked high in stress. The Northeast was clearly the epicenter for Wave 1. Finally, I show the death rates for each state, defined as total deaths as a percentage of total cases. The Northeast states are shown in green. The death rates are very high, with the U.S. average at 6.3%. Wave 1 caught everyone by surprise. We hadn't seen anything like this since the Spanish flu pandemic of 1918. We did not have adequate resources in place to properly care for this large an influx of patients. Hospitals were overrun. This is reflected in the extremely high death rate of 6.3%. Too many people died in Wave 1. By the end of Wave 1, the virus was everywhere. It was in every country in the world and in every state in the U.S. It was like a very large, smoldering brush fire covering the globe. Given the right conditions, a hot spot could erupt into a blaze at any time. Well, conditions did change for Wave 2, and a new hotspot did develop. Wave 1 occurred during the spring and Wave 2 during the summer. With the approaching summer months, the weather went from cold to warm in the north and from warm to hot in the south. Social distancing had become more difficult in the south as people spent more time indoors to escape the heat. This increased the opportunity for infection. In the north, it was just the opposite. The result was that the epicenter of infection had now shifted from the northeast to the south. Cases peaked at twice that of Wave 1. Hospitalizations were the same, and deaths peaked at half that of Wave 1. Wave 2 lasted about 3 months, about the same as Wave 1. Wave 2 swept through the southern tier of the country, from California to Florida. The southern tier states, in green, stand out as the most effective. The leaders from Wave 1 are shown in orange. The Northeast had cooled off, and the South was hot. The average U.S. stress index increased from 7.8 to 10.1. The stress chart shows again that the southern tier states, in green, had taken over from the Northeast states, shown in orange. The good news was that the death rate had dropped from 6.3% to 1.9%, with all states at 3% or lower, with the exception of Massachusetts. We were doing a better job of keeping people alive. Wave 2 added 4.5 million cases and 90,000 deaths, bringing the total for the U.S. to just under 7 million cases and 220,000 deaths. Unfortunately, the pandemic was not done yet. Things were about to go from bad to really bad with the arrival of Wave 3. Wave 3 was a monster. It started in September of 2020 and lasted 6 months, before finally bottoming out in March of 2021, completing the first full year of the pandemic. It blew away all the previous highs. Wave 3 was the first winter wave of the pandemic. We saw in Wave 2 how the hot weather affected the spread of the virus with reduced social distancing. We were about to learn the same harsh lesson about the cold. Everything peaked in January. Cases peaked at 260,000 per day, 4 times that of Wave 2. Hospitalizations peaked at 130,000, double the peaks for Wave 1 and 2. Deaths peaked at 3,500 per day, 50% higher than the previous high of 2,300 per day in Wave 1. We had about 4 times as many total cases in Wave 3 than Waves 1 and 2 combined. There were 100,000 more deaths than Waves 1 and 2 combined. It was a very bad winter. The case chart is remarkably similar in shape to the population chart, which we looked at earlier, with the states lining up very much in order of population. No state stands out as in previous waves, meaning that all the states shared more or less equally in the pain. The death chart is a little more ragged, but still closely resembles the population chart. The geographic area for Wave 3 was the entire country. This was a very bad wave, and it was bad everywhere. The average stress level increased from 10.1 in Wave 2 to 24.6 in Wave 3. With only a few exceptions, the stress level is uniformly high for every state. The 3 highest states were the small states of Rhode Island, South Dakota, and North Dakota, shown in green. The death rate was very uniform across the country as well, and was a slight improvement on Wave 2, down from 1.9% to 1.5%. Wave 3 added over 23 million cases and 330,000 deaths, bringing the total by the end of the first full year to 29 million cases and 550,000 deaths. This was an average of 45,000 deaths per month. The first vaccine was approved on December 11, 2020, and started being administered a couple of weeks later. The green line indicates the, quote, percent fully vaccinated, unquote, which generally means 2 shots. By the end of Wave 3, the U.S. was only about 10% fully vaccinated, so it was not yet a determining factor. Wave 3 was mercifully behind us, but Wave 4 was on the horizon. With the arrival of Wave 4, the U.S. was about to enter a new phase of the pandemic, the arrival of COVID variants. At first glance, Wave 4 doesn't look like a wave at all. It looks like a blip on the downslope of Wave 3. However, there was a definite uptick in cases of infection and hospitalizations. But deaths did little more than level off before continuing their decline. Wave 3, which we just covered, was a devastating wave. Up to this point, we'd been dealing with the original strain of the COVID virus. Britain also had a devastating wave at the same time as our Wave 3. However, it was fueled by the first COVID variant, the Alpha variant. A few months later, in the spring of 2021, the Alpha variant had become the dominant virus in the U.S. It was the major driver of our Wave 4. Why wasn't Wave 4 more serious? Alpha had hit Britain in the fall and winter, which is the worst period for infection because of the cold weather and the reduced social distancing. Alpha moved on to the U.S. in the spring as it was warming up. That and the fact that the fully vaccinated population had reached 40% by the end of the wave were probably factors in keeping the infection rate relatively low. The weather was in our favor. The big states dominated the case and death numbers, with only Michigan standing out from the crowd. The average stress level dropped from 24.6 in Wave 3 to 7.3 in Wave 4, the lowest for any wave so far. Michigan, shown in green, had a relatively high stress level. Other states on the high side, shown in blue, were New York, Pennsylvania, New Jersey, Rhode Island, and Delaware in the Northeast, along with Florida, Colorado, and Minnesota. The U.S. average death rate at 1.2% was also the lowest of any wave so far. Wave 4 lasted less than 4 months and brought our totals to 34 million cases and 600,000 deaths. We had suffered about 600,000 deaths during the Spanish flu pandemic of 1918. The U.S. population at that time was only around 100 million, compared to 330 million now, so it is not a direct comparison. Unfortunately, a new variant, the Delta variant, was devastating India at the same time as our Wave 4. Delta was heading our way and was about to spoil our summer. At the end of Wave 4, things were looking pretty good. Everything was winding down to near pre-pandemic levels. The Delta variant from India put a change to all that. During the same period as our relatively mild Wave 4, Delta was ravaging India and peaked at 400,000 cases per day and over 4,500 deaths per day. These were the highest numbers of the pandemic so far, anywhere. And this was only what was reported. It may have been much worse. New cases peaked at 167,000 per day, and hospitalizations at 97,000. Both second only to Wave 3. Deaths peaked at 2,000 per day, well below Wave 3 and slightly lower than Wave 1. Wave 5 was another very bad wave. Not as bad as Wave 3, but very bad. It struck in early September. Had it arrived a few months later, during the winter, it would likely have been much worse. Vaccinations were now in the 50 to 60% range, so that might also have helped keep the numbers from being any worse than they were. The three largest states in population, California, Texas, and Florida, also had by far the most deaths and cases. Otherwise, not much to comment on here. The average stress index had increased from 7.3 in Wave 4 to 19.1 in Wave 5, lower than the 24.6 of Wave 3. The hardest hit states, shown in green, were all over 25 stress index. Hot weather states, much like the previous summer wave, Wave 2. States from the Northeast were all below 15. The death rate stayed low at 1.3%. Delta lasted 4 months over the summer and early fall. It peaked around the 1st of September and added 12 million cases and 164,000 deaths, bringing our totals to 46 million cases and 770,000 deaths. In waves 4 and 5, we had experienced two serious COVID variants, Alpha and Delta. It was becoming clear that we would not be done with the pandemic as long as the virus found the necessary conditions to reproduce and mutate and spread. In November, around the time that Delta was winding down in the U.S., a new variant, the Omicron variant, was identified in South Africa. A few weeks later, it became the dominant virus in the U.S. An Omicron wave seemed inevitable. And yes, winter was coming. The Omicron variant was identified in late November in South Africa. It was said to be far more infectious than any previous variant, but to have milder symptoms. Wave 6 started off slowly in early November. By mid-December, we were experiencing a dramatic increase in new cases. The wave peaked in January and then started its decline just as dramatically. Wave 6 lasted 5 months and ended in April 2022. We had just ended the second full year of the pandemic in March, and we're now beginning our third year. Winter is indeed the cruelest season. The previous worst wave was Wave 3. Wave 3 peaked last winter in January. Wave 6 also peaked in January, almost exactly a year later. How bad was Wave 6? Wave 6 cases peaked at 3 times the Wave 3 peak. On the worst day of Wave 6, we recorded almost 900,000 new cases. That's close to 1 million in one day. It took 72 days to reach our first million cases in 2020. Wave 6 accounted for over 40% of the total cases incurred since day one, 25% in January alone. Hospitalizations also set a record with 152,000 hospitalized at its peak. Deaths peaked at a high level as well, second only to last winter's Wave 3. Total cases were distributed fairly evenly according to population. Deaths seemed to cluster more in the big states. The stress index increased from 19.1 in Wave 5 to 38.3. This was the highest of the pandemic to date. As you can see, it was uniformly high across the entire country. The death rate was very low at 0.6%. Omicron was indeed less lethal, but the extremely large number of cases resulted in a very high number of deaths anyway. Wave 6 added 34 million cases and over 200,000 deaths to bring the final total for the 6 waves after 750 days to 80 million cases and 990,000 deaths. Think about it. That's about as many deaths as the entire population of Delaware. By the end of Wave 6, the numbers had dropped to a very low level, much like they did at the end of Wave 4. Mask mandates were ended. Life was returning to normal. The country was optimistic. With Wave 6, we are up to date with this overview of COVID in America. This would normally be a good place to end. But those pesky variants were still lurking out there. A new subvariant of Omicron had already been identified, subvariant BA2. BA2 was spreading rapidly to Europe and the Far East. By the end of March, it was the predominant variant in the U.S. as well. It was said to be more transmissible than Omicron, but probably no more lethal. Nobody knew for sure. BA2 was replacing Omicron. In any case, by the end of March, it didn't seem to be having any noticeable effect on the U.S. numbers. Not so in the rest of the world. Before finally calling it a day, I think it is probably worthwhile taking a closer look at BA2. The first chart looks at what was happening in the rest of the world over the 2 years of the pandemic. I've shown the U.S. in blue and the rest of the world in red. Both lines show the same wave action, with flow of the two lines more or less following the same contours for the first 5 waves, but something unusual was going on in Wave 6. Both lines exhibited a sharp peak in January and started dropping just as rapidly. By the 1st of March, the U.S. had dropped to an extremely low level. But on the 1st of March, the red line, which was still at a very high level, started back up again. Something was happening that did not affect the U.S. Since wave 4, each wave has been caused by a new version of the virus, Alpha, Delta, Omicron. By March, BA2 had spread almost everywhere, so this March spike in cases outside the U.S. must be the result of the BA2 wave, which had overlapped the Omicron wave. How do we get the BA2 wave to show itself? I started by sketching in what the Omicron wave might look like if BA2 did not exist and Omicron followed the expected trajectory downward. This is shown by the dotted red line. The dotted line is the Omicron wave without BA2, and the solid line is the Omicron wave with BA2. The difference between the two lines must be the BA2 effect. If we subtract the dotted red line from the solid red line, we should see the BA2 wave. Stay with me, I know this is a bit of a stretch. So I subtracted the dotted red line from the solid red line, and there it is, the BA2 wave in black. It's worth noting that this approximation of the BA2 wave has a higher peak than any other red line wave except for wave 6. BA2 is a very serious virus. As we have seen, Omicron was a very aggressive variant. BA2 is equally aggressive, but so far seems to have limited its damage to Europe and the Far East. Since late February, South Korea has led the pack in new cases, joined by Vietnam, Japan, Thailand, Australia, and even China, as well as much of Western Europe. The U.S. might see a significant BA2 wave, but so far has been spared. So what does all this mean for the U.S.? Will we see a BA2 wave? At the conclusion of wave 6, we are at a very low level of cases, hospitalizations, and deaths. But since the 1st of April, both cases and hospitalizations have begun to inch up very slowly. The virus has always been one step ahead of us. This could be the start of a wave 7, or not, but that is a discussion for another day. This summary of the first 2 years of COVID in America has come to an end. But the pandemic continues. It's now April, but as they say, winter is coming. How we do next winter will give us a good idea of whether COVID is finally behind us or not.